All right, we'll get started. Good morning. My name is Anand. I'm part of the Malnad Ultra team. Today, it's my pleasure to welcome Dr. Chiran Babu, who is a four-time veteran of the Malnad Ultra. He's also a very well-known cardiac surgeon, cardiac and thoracic surgeon based out of Kauvery Hospital in Bangalore. Um, Not just because he's a runner, but he's also been practicing for close to 20 years. Dr. Chiran would be an ideal guest to have on our program today. As runners, we do want to make sure that we get sufficient information out there on what running can do for your heart. It's obviously good. It can also be bad if done in excess. So, Dr. Chiran, I'm going to sort of help you moderate this session. If you don't mind, maybe a couple of minutes, your own journey with running. How do you view it? You know, from your standpoint as a cardiac surgeon or a cardiac specialist, I should say.
Thanks, Anand. Thanks for the beautiful race. That's Malnad Ultra, which you conduct every year. I've had interacted with a lot of people who have run your various editions of Malnad Ultra. There have been a T number of complaints. But one thing I'll never accept is your race is the best race what I have run so far in India.
Thank you.
Best race. I think the logistics, the route, the support on the route, everything is the best. People expect a support like a road race and come to the trials. I think they will be disappointed. So there will be people who will be cribbing. I think you have to just listen to them and then keep doing your thing. Please continue doing that. Anyway, thanks for the lovely introduction. I'm a cardiothoracic vascular surgeon who's been practicing for more than 21 years. Actually, I was not born and brought up in Bangalore. I came to Bangalore way back in 2004. But my running journey started almost a decade later. I was never into any sort of physical activity or any sports or games, except for a brief duration during my high school days that I played basketball, but never into running or athletics or anything. I had a major sort of a health scare in 2010, which made me reevaluate my lifestyle. And then slowly I started for the next 3 years. And from 2013, later part of 2013, I joined Jayanagar Jaguars. And the journey from then on has been really helpful, both in rediscovering my passion for the running, as well as it has given me a lot of support in my actual work, that is the surgical work. And running, they say, particularly the long distance running, they say is a mental game. So it has made me tough mentally, and that I lean on so many number of times during my difficult times during my surgery. So I have been borrowing this mental toughness both from my surgical aspects, surgical work, as well as during my endurance running. So far it has been quite uneventful for me, but the journey has been really fantastic. I started off before joining JJ's. I just ran an unplanned half marathon, and I was probably dead for a week or so. So that's when I realized that probably you need a structured training. You can't just go and run a race and then try to be going on doing your work as usual from the next day onwards. So since I joined JJ's, I had a very structured training. And slowly I graduated the distances, and I've been here today. I ran 4 editions of Malnad Ultra and a couple more ultras, in most of them in southern India. That's right.
Okay, thank you. So now we'll get into some of the topics related to today's discussion around running and the heart, right? So there's no question that exercise is beneficial. Uh, there's absolutely just overwhelming amount of evidence that exercise is beneficial. But is there something, like everything else, too much exercise can't be good for you? So in your opinion, let's keep running as today's form of exercise. Is there any benchmark that you suggest how many days you should run, how long you should run, how many minutes, what pace? What are your thoughts on this?
I think one thing what we should remember is we are not elite athletes. We are recreational runners. So it's for fun. We do this running. So let us not get into that elite business and then talk about all those stuff. See, for us, for a common man, even the WHO recommends that 150 minutes of physical activity is good enough per week. 150 minutes of moderate physical activity is good enough to maintain your optimum cardiac health, they say. So 150 minutes of cardio activity, you can decide on that. Over and above, you want to do any specific distances, any specific time interval training, it has to be a slow, structured training program. Otherwise, you are bound to end up either with injuries or currently what we are seeing with any major cardiac events or fatalities. So what I would recommend is anyone, any new person who is getting it, irrespective of their age, they should probably speak to their physician or a doctor who's known to them and then try to evaluate themselves. Because basically, if we have not done any physical activity during our younger days or whatever there before we start the running journey, there can be so many issues which might not have been found out. Those factors can be detrimental to your running journey. So even though it is less than a percentage, that 1% risk is not worth taking, because we have got a responsibility in this society, particularly when we do some activity like running, that any untoward incidents happening will be highlighted the maximum. So it's a duty towards ourselves, our family, and towards the society. Get a basic health checkup, get your heart tested, any structural abnormalities is there in your heart, get it fixed, and then start your journey.
Okay, so obviously starting slow is what you're recommending.
Yes,
so yeah, you start slow and then you discover how your body reacts to and you progress accordingly, right? There is this whole theory around slow running, right? That slow running or aerobic running or running well below your aerobic threshold, that is beneficial. And now there's a lot of people who recommend slow running. Don't worry about your heart rate and all these fancy gizmos or training plans. Just run slow and enjoy the run, and you can progress. What are your thoughts on that?
Yeah, see, basically, I really concur with this concept. That's one of the major reasons why I gave most of the times I don't do any road racing nowadays. It's only the trial. So where I'm only concerned about what is the perceived amount of exertion my heart gets. So I try to do training for that one, any event based on this, like what you told, a heart rate based training, slow, long, steady runs, and here and there you mix it with a couple of intervals and then speed training. That's all.
Okay. So it seems like the number of running coaches, it almost seems like there are more running coaches than runners these days, right? So you look anywhere, there is dozens of various plans that structure over 18 weeks, 16 weeks, whatever that is, right? And there are now companies selling devices, heart rate monitors, chest straps, all kinds of stuff. Is there something that recreational runners should invest in, or should you just listen to your body? I mean, there is a common saying or common observation. You just watch your breath, and as long as you're in control of your breath, you keep running. What are your thoughts on investing in all this fancy technology and training plans? Do they help you progress quicker?
No, I think even you make use of these devices, you should not hurry up the process. Probably these devices are going to be a part of your journey. I think now the human mind is such that most of the people would love to have a device with them, whether it is running or not related. More so with the any physical activity, cardio, running, cycling, whatever it is. It definitely will help in your journey, but you can't hurry up the process of graduating from a shorter distance to longer distance and to a trail run. You can't expect someone, okay, you can't get into the peer pressure that, hey, come on, man, there is a trial race, it's only 30 kilometers, come on, you can run, you have run a road race, and don't fall into that trap, because the, the terrain, the race, everything changes. So until you have not graduated to that during your practice runs, there is no fun in that. You going to a trial for the first time without much training or exposure, not having a good experience there will totally put you off, probably total running itself. So there are no shortcuts in running, and what one should remember is, never forget about this. We do this for fun. So there is no use in trying to punish yourself and then go through very tough times. Of course, there'll be tough days in your training period. That I totally agree. But listen to your body. If your body doesn't feel like it's letting you know that, yeah, today you're not feeling well, blah, blah. So you cut down your training, whatever your coach has given. That toughness, what the coaches, like now what Anand said, there are hundreds and thousands of them. They'll try to make you more tougher. I think, according to me, that toughness is not developed by trying to push yourself to the maximum and so-called the pain cave and all. You accept the problem. Yeah, you are having problem with your training. You accept that problem, find your ways and means. So you have to be patient enough. That's all. You have to be patient enough, put in more time, effort, and try to address your problems, and then get on with your training. If your body doesn't permit you to do a workout on that day, please listen to the body.
Sure. Makes sense, right? Um, yes, I often read articles which say that Indians as a race are more susceptible to cardiac issues. Do you buy into this theory? Is there enough substance behind this?
Yeah, definitely. We, as particularly the South Indians, we are racially very much predisposed to, coronary artery diseases. Means the blockages in the blood vessels which supply blood to the heart. Our blood, those blood pipes which supply blood to the heart, are comparatively to the white population, they are much smaller, and they are much more prone to develop blockages because of the nature of the food, probably what we eat. Okay, so definitely we are much more predisposed to develop these blockages. So we should be careful enough before pursuing any endurance activity, so that such blockages leading on to any events, fatalities in the event, should be much before diagnosed and addressed. That doesn't preclude you from pursuing any endurance activity. I don't agree to that fact. And one thing what everyone should remember is, everyone, even whether you have a predisposing factor like a diabetes, hypertension, smoking, so many other things, it is our duty to evaluate ourselves on a regular basis in order to prevent any fatalities during a training period or during an event. And one more thing I would love to say is, there's a common misconception among the runners that I'm fit, so I'm healthy. So being fit is not equivalent to healthy, sir.
Sure.
And being healthy, you can't be fit also. So both are not one and the same. So that once we understand, the things become easier for us to accept that fact that Even though we are fit, we have to take care of our health as such, and more so the cardiac health.
Sure. Thank you. So, I mean, it's interesting that you mentioned South Indians are more susceptible.
Yes,
I mean,
yes.
I mean, is it sure we are different from people in the north? I get that, but what has changed? I mean, has our diet changed? Have we gone into a Western diet in the last 15, 20 years? Is there more fast food, quick food? What has changed? What has accelerated these
No,
issues?
definitely. Our eating habits has changed drastically, and the amount of time the people who are sitting and working, that has increased drastically. That happened during COVID, and now still it is continuing. What will be a surprising thing to hear is WHO considers sitting continuously for more than an hour is almost equivalent to smoking. So, if you're forced to sit and work continuously, what they recommend is please take a break, at least a 5 or 10 minute break each hour. Go walk around, step out, cover few steps, then come back and sit and work. So,
Okay.
what is important to note in this is the same risk factor as smoking, continuous sitting gives you to develop heart diseases.
Sure. I see few questions in the chat window. We will get to the questions at the end of the session. No problem. Dr. Chiran, what about gender? I mean, is it true that men are more susceptible to heart disease than women, or
No,
do you buy into
probably
that?
about a decade or 2 decades back, that was a fact that men were more predisposed to. Nowadays, no. I think both men and women are equally predisposed to develop heart diseases, provided their estrogen gives them a slightly better margin or to prevent them from developing the heart diseases. Once they reach menopause, it is almost the same risk for both men as well as the women.
Okay. And how about age? I mean, obviously, your body slows down, recovery takes longer. But is there an age beyond which you should not be running, or do you say keep running till you?
No. I
you
think
know?
I think we have to be prudent about talking about this loudly in a forum like this. The thing is, your body, your physical capacity is not determined only by your heart. It's dependent on your musculoskeletal capacity also.
Sure.
Ensure that your heart is quite good enough to do any sort of cardio activity, and if your body permits, continue till such time. There is no age limit. Till such time your body permits.
Yeah.
But make sure that as you age, the amount of surveillance, the heart surveillance should be much more stricter and much more rigid.
Sure. Now, one of the things we've been conducting the Malnad Ultra since 2016, and since you've been there 4 times, it is a remote area, and there's many parts of the course where we cannot actually support runners with ambulances and all the things that you can do in the
Yes,
city,
yes,
right?
yes, yes.
So, as organizers, what do you suggest that we can do? We try to make sure that we're tracking runners in every section of the course, but beyond that, what do you think organizers can do better? Not just at Malnad Ultra, but in general. I mean, there's a lot of races coming up in India these days.
Yeah, I know. I know. There are limitations in a trial run to provide a medical help. I think you people have been doing fantastic work regarding that. I think beyond which it is the onus falls on the runners before venturing out to a trial running. I think it is foremost important to ensure that they are in a fit condition or their heart is in a fit condition. They have to ensure that. You can't put the blame entirely on the race organizers so that the help was not available immediately. Imagine in a road race, someone collapses, whether the patient can be restated and he can be saved or not is a question about how that person behaves after resuscitation. Imagine this scenario in a remote area in a trial. It's very difficult. It's really difficult to say. So the onus falls on the runners. They have to be more proactive in ensuring that their cardiac health is optimal before venturing out to these sort of races. Do a regular annual checkup. That's good enough. That's been nowadays majority of these companies will provide for these annual health checks, depending on your age and the risk factors. If there are risk factors, definitely you have to be a little bit more aggressive in your cardiac heart evaluation. If not, a regular routine health checkup will detect so many common entities in your heart. A simple echocardiogram will detect any structural problems.
Okay.
If that is addressed, yeah, it will be taken care of. And please, one more thing is people who are on medications should ensure that they continue these medications when they are running. It's not that the race starts at 4 o'clock in the morning or 3 o'clock in the morning. I take the medicine at 8 o'clock in the morning, so I can skip this medication. Please don't do that. Whatever medications you are on has to be continued on the race day also. Probably that is one more thing which people overlook, and then that can cause serious problems also. Whatever the medications.
Sure. So since you brought up medication, I'm going to cut over to a question that has come up in the chat window.
No.
So Deepak asks whether runners over 50 years old should use blood thinners on race day. Now, I don't know if he's talking about runners who are prescribed blood thinners, or whether even runners who are not prescribed blood thinners.
This is just like scaremongering. Just taking a blood thinner on a race day is not going to help us in the long run. So before that, if you have ensured that you have done all the checkups, the cardiac evaluation, and if the doctor has recommended a blood thinner to you, yeah, you are entitled to take a blood thinner. Otherwise, just taking a blood thinner and running on a race day is not going to confer you any additional protection. Definitely, it's not going to, because if you don't know there is any structural problem with your heart, the blockages or whatever it is there or not, just blindly taking a blood thinner is not going to prevent any fatalities during the race.
Sure. And just one more question. So Jitesh, has a clarification. You mentioned at the top of this meet that 150 minutes of exercise per week is what is recommended.
Yes.
But he wants to know if should this recommendation, is this for beginners, or can experienced marathoners, runners also do more?
This is for a common man, the WHO recommendation. I'm not telling for a seasoned runner. No, I'm not telling it for a seasoned runner. For a seasoned runner, whatever training program he is into, he can ease into that program and then escalate the training.
Okay, super. Now, again, anecdotal, right? So we all had 2 difficult years with COVID. It seems like post-COVID, the number of incidents are more. Is there now an established link between, COVID and heart disease, or is this something, people just did not do enough in those 2 years and came back too soon, and that is why we are seeing more incidents?
Arun, let me be clear on this thing. The COVID disease as such caused a lot of blood-related problems. It made the blood more thicker.
Yeah.
Okay. So that led to a lot of heart-related issues during the COVID. And what people are talking about post-COVID, people developing heart problems is related to COVID vaccine and all, is still not very factually confirmed. Okay. Might be a possibility. But I don't accept the fact that every person who has taken a vaccine is prone to develop heart disease. It is more to do with this 2 years of, probably 2 to 3 years of gap in the physical activity and the amount of stress that each individual has gone through, and their change in their pattern in the eating habits. Everything has contributed to these things. And resumption of these, whatever the cardio activities, probably some people have been probably hurried through the process also. That's what I feel.
Okay.
If I given more time, probably to get back to their races or whatever.
Okay, so it's obvious they were used to a certain level of activity. They took a long break. You again start slow and you ramp up slowly. Yeah. Okay. Another term that I hear and I pay more attention these days because I'm part of an organizing team myself is myocardial fibrosis. I mean, people talk about scarring of the heart and all of that. What is your take on this? Is running making that worse, or does running cause this to become worse, or what is the deal on this?
No, see, thing is, this myocardial scarring or fibrosis, that is what happens. Particularly, there is broadly the left heart and the right side, left side of the heart and the right side of the heart. This is more seen, the myocardial scarring or fibrosis is more seen on the right side of the heart, right ventricle, where when the perceived effort of exertion is more in an athlete, with less recovery time, they can develop myocardial fibrosis, which can, in the long term, probably years together, can lead to myocardial fibrosis, and that can lead to heart failure, and they can have death also. But this, in our community, is probably an anecdotal thing. But what one can do, even an endurance runner who puts in a lot more miles, everything, these things can be detected by a simple 2D echocardiogram, which can be done annually.
Okay.
Which is not going to cost much. A simple 2D echocardiogram will give you roughly ideas about the condition of your heart, whether it requires further evaluation or not. Are you good to go ahead with your training program and do whatever the race you have signed for?
Super. So running is a social sport, especially events, and trail running, I think, builds much stronger bonds than road running. There's no question about that,
Sure,
right?
no doubt about it.
Yeah, been running like you. We've been on trails for a long time, and some of our best memories have come from running on trails, right? So if I'm a trail runner and I go into a remote event such as ours, uh, how can I helps others? I mean, for example, if I'm running with somebody, what are the symptoms that I look for in a fellow runner, where I know this person is coming into trouble? Or how can I prepare? For example, should I do CPR training? What do you recommend for us? I mean, we want to help people on the trail, of course.
Yeah, I know this CPR training is a must for even a common man.
Yeah.
But that's a fact. That's a fact. But it's highly unlikely that we'll be able to implement it in a large scale in the next few years or so, probably. But in a race like yours, I think the race organizers and the probably people who are going to help you out, if they are trained with CPR, definitely that's going to be a help, according to me. To tell you, quote you an example, last year when I was racing 50, I found one person at 2 point of times. He was extremely dehydrated, almost like sunstroke and all. I couldn't make out from his thing. Then we stood, made him drink water, lie down, we told. But he was supposed to run the 100K race. Then he slowed down, then he came back. I finished my 50K. Then he finished and came back. Let me not take the names here. He looked okay to me. I asked him, "What do you want to do, sir?" "I'm feeling okay. I'll rest for an hour and see." Then he ran and he finished. But he listened to whatever I told immediately. He didn't push at that point of time. Pushing probably at that point of time would have created some fatal event, or I don't know.
Yeah.
So I think your whole team as such, and probably people who will help out during the race, if they can be trained with CPR, basic life science, that is the basic life support, sorry. CPR, and then immediate emergency, whatever things need to be done, that will be really good.
Okay. So I hear, I'm aware that there are courses in all big cities now in India. In fact, some of these courses are for free. Can you recommend some chain or something in Bangalore, Chennai, Pune, so some of our runners can benefit? Or are you not allowed to recommend other institutions?
No.
Yeah,
It's
okay.
not that.
Yeah.
It's not that.
Yeah.
I think
Because people don't know that it's available so easily.
Yeah, definitely. I think these training programs are being conducted by all major corporate hospitals, depending on the not this one, the requirement from the community. Like for a community request for this CPR training, definitely no hospital will say no.
Yeah.
But one thing what probably I would want to quote here is there's this Bangalore Sports Foundation who have recently taken up this uh, basic life support system, training the common man with the CPR.
Mhm.
They're going to do it. They are planning to do it in a big way,
Okay.
training the community people and particularly the corporates, everything, so that these are the people on the road. When someone collapses, if these people are trained, they are the ones who will be there when such an event happens. So if they can give that primary support care, probably the patient's life can be saved.
Sure.
Many major corporates will be providing these certification courses. Only thing about these certification courses is you need to upgrade them continuously.
Sure, understood. So, obviously lifestyle is very much related to your overall health, right? So, stress, you mentioned sitting for long hours, stress, your lifestyle, mood changes. Everybody endures stress on a daily basis. Just driving around in Bangalore can be very stressful. So, how do runners sort of cope with this? I mean, I know a lot of runners like to meditate and do things like that, but any suggestions on that front?
No, stress can be at various levels.
Yeah.
There's general stress of the day-to-day life, like driving, you told, or stress at the work level, uh, because
Yeah.
of pressure at the work. And most other important thing, before I forget, I think I already forgotten, adequate sleep. No one bothers about it because everyone is so short-stretched about these things. Everyone is bothered about only the training. Even with 2 hours of sleep, tomorrow they've got a long run, they'll try to go ahead and try to finish all that. Please, please, please don't do that. Try to get at least adequate amount of sleep before you plan to do your at least the long distance running, because inadequate sleep is one of the major factors of any cardiac events.
Mhm.
You have to reduce, you have to find your own ways and means to reduce the stress in your life. Probably the most important thing will be talking to your friends and finding out what is causing you more stress, trying to find ways and means. If not directly, there should be no hesitation in reaching out to a psychiatrist or a counselor in order to find ways and means to reduce the stress. If you don't address that stress, that is a ticking time bomb. It's going to hit you in one way or the other.
Okay. So, go over to a question in the chat window. Now, I'm not familiar with this myself, but
Okay.
Deepak mentions Valentine Fuster research. So, what do you have to say about that? That apparently also relates to moods and psychology and general happiness.
No, sorry, I'm not aware of this.
Okay.
Really.
So, Deepak, you have to figure that out on your own. Okay.
Or you can talk to me probably. I'll
Yeah.
talk to my.
Yeah. Naveen asks about a calcium score test.
Yes.
Is that something that you recommend?
No, that
Should
is
be...
what I've not intentionally spoken about this, the tests or whatever it is. The calcium score test is one thing which will give you an idea about how bad these blockages are there in your blood vessels, that is a coronary arteries, blood pipes which supply blood to your heart. People probably above 40 who have got risk factors, who are much younger also, like diabetes, hypertension, obesity, before embarking on an endurance activity or a training program, it is worthwhile spending money and then getting that done. It will give calcium scoring, will give an idea about what is the load of the calcium in these blood pipes. And along with that, the study will be done by giving an injection dye. So any blockages are there, what is the degree of blockages, anything to be addressed or not medically or surgically, that information also will be gathered. So I think it is worthwhile considering that CT coronary angiogram.
Super. Shashi Prabha, talks about something which is again a lot of people they talk about, genetic factors. So Shashi Prabha says, her dad has a history of heart disease, and um, even though she gets her investigations done every year, and
Yeah.
all the reports seem to be generally normal, do you recommend people who have a genetic history or history in the family to have such investigations more frequently, or once a year is sufficient?
No, once a year, the routine investigations, what the regular hospital, this one recommends,
Yeah.
depending on the age. And in the background of strong family history, I would recommend to do a CT coronary angiogram. Probably this is not there in the norms where the American Heart Association doesn't recommend this. But to be on safer side, if there is a strong family history, please do get a baseline CT coronary angiogram, which will give us an idea. Depending on what findings are there, you can repeat that once in 3 years or 5 years. A strong family history is a definitive incremental risk factor in that person developing blockages. So you have to take care of your heart. It's not only your heart, your life, your family's life, and your friends.
Yeah. True. Anyway, thank you. It's been amazing to chat with you. I have no more questions that I can think of. I can open up the questions to the audience, see if somebody has questions. So Jitesh asks. Okay, so Jitesh wants to know about speed zones. Essentially, he wants to know how much speed running to do in speed zones 4 and 5. Again, this is modern training techniques. So
Yeah, this I think you go to any of these smart watches, it will give you your speed zones based on your age and whatever the weight, whatever the data you enter. So just to follow those zones, that's all. Heart rate you want, according to me, you have to reach maximum 80% of your target heart rate. That is 220 minus your age. That is what in our cardiac sensors we recommend. But as runners, let us keep this thing little bit less only. 180 minus your age should be your comfortable running heart rate. That is an aerobic endurance run. Ensure that your heart rate is in that zone. Obviously, when you do speed runs, speed trainings, your heart rate is going to go way high above that thing. That is the benefit you get out of training doing these speed runs. But for most of the times, when you want to do an aerobic endurance training, do in that heart rate zone.
okay, so you buy into the 220 formula for Indians. There is I've read somewhere that 220 is a Western idea.
That is for a common man who wants to keep his cardiac health, who goes walking, and then after walking, he'll have probably sufficient calories to compensate for that, whatever he has done. For at least for runners, let us be cognizant of the fact that whatever the calories is burnt, you need not go back and then ensure that double the amount of calories to be consumed. Okay. For runners, at least, I will recommend this 180 minus your age for heart rate calculation.
Yeah.
Not 220 minus your age.
The Maffetoni formula.
Maffetoni.
Super. Sudeep asked a very interesting question. So when you go running, physically when you're recovering, because your joints, your pain levels will come down, whatever aches you have. But how do you know from a cardio perspective that you have made sufficient recovery before you get into your next run?
See, if you're not breathless when you're running, simple, it is as simple that you have ran yesterday. If you want to do another run today, when you start your run, if you're not breathless, even after a kilometer or two, you're breathless. Yeah, your body is telling you to rest. Simple as that.
Okay.
And with the smart watches available, it will give you your training load also. And the the recent concept of heart rate variance, which is available on Garmin also and Coros also. That will tell you clearly that, yeah, you need to rest. You cut down your activity today.
Super. So again, something about testing. So I'm going to read this as is because I don't fully understand this myself. Sure. So Venkat Ramana asks, from a cardiac rehabilitation point of view, is it feasible to recommend any runner to go through cardiac risk stratification and treadmill stress test to analyze his risk and check his eligibility to participate in a high intensity activity?
Yeah, Cardiac rehabilitation means you would have had a cardiac related intervention or a surgery. Definitely, before he embarks on any race, it is worthwhile doing a treadmill test, or now there are many non-invasive tests available. You can do a myocardial perfusion stress study also, and rule out that whatever the problem was there for which treatment has been done, the treatment is very well and working, and then he can embark on his races or training schedule.
Okay. Again, a technical question, which I will read out. So somebody wants to compare the stress score of a 21K road run versus a 30K at Malnad Ultra, which is our entry distance. So I don't know if that's something you can guess or estimate.
I think stress will be equal in both the races if you haven't trained properly.
Okay. So it comes back to training.
Training. It comes back to training. Training means training not only your legs.
Yeah.
Training involves training your legs, putting in minds, training your mind also.
Yeah. I think we touched upon this briefly, but Ashwini asks, what are the red flags to watch for in a fellow runner? I mean, if you know somebody is having or on the verge of an incident, what are the red flags we should
look? He's extremely breathless, and he's gasping, and he's not coherent. Please stop that person from running furthermore till someone assesses him. I was able to do this last year with 2 people. Both of them completed the races because at that point of time they were in no position to proceed further, but they understood that fact. They took a break, and whatever needed to be done, the hydration, the nutrition was taken care of. But if that person was having a cardiac activity, I don't know what I would have done probably. There are called help and then try to be with that person till the help arrives, and then whatever minimum we can do in that remote location, we would have done it. That's it.
So, do you make the patient lie down?
Yeah. First thing is, make the patient lie down, lift up their legs, and ask them to just breathe. Not only mouth breathing, nose breathing, and all. Just breathe. Breathe in, breathe out. Breathe in, breathe out. Just do this for a few minutes, and then when they're not too breathless, make them sit at least, and then give them something to drink or eat if they're capable of eating. Most of the times, when say heat stroke or heat exhaustion, they'll be throwing up. So it's very difficult for them to retain. If that is happening continuously, then don't force them. Otherwise, if they aspirate, that will be another big problem to tackle them.
Sure. How much do you elevate the legs? Is there an angle you recommend?
Yeah, up to 90 degrees.
Up to 90 degrees.
If you can tolerate. Only just that helps by pumping. It means letting the more blood flow towards the heart.
Sure. So Zubin asks, he again talks about history in his family. When he goes running, his max heart rate sometimes touches 180, and his average heart rate for the whole workout is in the neighborhood of 170. Is that too high?
Yeah, I think how old is he?
He doesn't say so. It's a question on chat.
No,
so
I think
it seems high from my point of view. Also, it seems kind of high. So
yeah, 170 is a bit too high. I think he has to cut down his pace. He has to start doing a heart rate based training, and then definitely that will improve his probably this aerobic endurance during race. Yeah, you give your everything and then run. I think that 80% max heart rate should be okay. Yeah, I think Zubin is put 35 years. 35 years also, it is too high, Zubin. Your average heart rate being around 170 is a bit too high. You need to do a heart rate based training to get it down. Definitely. In the long run, this is not good. These are the sort of runs, if you continue doing, can have a possible adverse effect on your heart.
Super. Dr. Chiran, it's been a pleasure. I don't know if you're coming out to Malnad this year, but thank you for
No,
giving us your time on a Sunday.
I have some other commitment, unfortunately.
Okay, you're going to miss this
Yeah.
year. Okay, but anyway, thank you for your time. I appreciate giving us close to an hour on a Sunday. Thank you to all the participants. We hope this was a useful session. I saw a question on whether we will make this recording available. Yes, we will make it available on our website, and we will leave it there for people to refer back to. Okay, thank you all for joining. Dr. Chiran, thank you so much.
Thank you.
Bye-bye.
Thanks, everyone.